First place I'd like to start is just update context nationally. We're at 213,000 cases nationally, close to 85,000 of those are in the state of New York. Total U.S. deaths passed 4,500. New York, 2,373. Again, I start with this because there appears to be some people that feel like when it was in China, that was so far away, it would never happen here. When it was in Europe, it would never happen here. And now there are still some people that believe because it's happening in Louisiana and Washington and not just New York, but all the surrounding states around here, that somehow it can't happen here. But the preparation that we're doing and the mandates and orders we put in place are exactly that, because the virus doesn't discriminate by geography. It doesn't discriminate in any way in terms of humans, and so everybody's susceptible to this. We know that it's more susceptible to people that are elder and with underlying health disease in terms of susceptibility to having this be a fatal disease. But again, we want to launch off by asking that everyone acknowledge and understand the orders that we've put in place, and we're super grateful for all the people that are following those orders. Today, the North Dakota Department of Health confirmed 12 additional cases of the novel coronavirus disease, or COVID-19. Our total for the state now stands at 159 positive cases. As we shared yesterday at this briefing, we're moving from sharing case data twice a day to once a day. And so today's reporting of 12 only is from a very short period. That's from approximately 3 p.m. yesterday, when we consolidated the numbers that we reported yesterday here at the briefing at 4. And then this includes 12 cases between 3 p.m. and midnight last night. So on a cases per hour basis, that is on a pace that similar to what we've seen on our most number of positives per day. Tomorrow morning at 11 o'clock, we'll be reporting a full 24-hour period again, as opposed to a 9-hour period. So we would expect that tomorrow we'll have a higher number than we had today. When we take a look at that curve again, even with that short reporting period, you can see that the growth in that curve continues to climb up. And as I said at the opening, there are no states in the U.S. where the curve is declining, and our growth rate is lagging. We're 2 to 3 or maybe even 4 weeks, depending on how we flatten the curve, behind other states. And so we're still in the beginning stages of the work that we're doing to try to slow this spread. In terms of what are we doing to slow the spread? It's the same things that we've talked about before, which is about, when we talk about North Dakota Smart, which is stay home, stay healthy, and stay connected.